ABGs stand for arterial blood gases. They are a blood test. ABGs tell us about the gases in your blood. These gases are oxygen and carbon dioxide. ABGs also tell us about the acid-base balance in your blood. Doctors use ABGs to check your lung function. They can see how well you are breathing. ABGs also help doctors check for problems like kidney failure and diabetes. ABGs are important for many reasons. They help diagnose and monitor various health conditions. Understanding ABGs helps us provide the best care for patients. ABGs measure four main things: pH, PaCO2, HCO3, and PaO2. pH tells us how acidic or basic your blood is. PaCO2 measures the pressure of carbon dioxide in your blood. HCO3 stands for bicarbonate. It acts as a buffer to help regulate pH. PaO2 measures the pressure of oxygen in your blood. Each component has a normal range. If a value is outside the normal range, it can indicate a problem. For example, low pH means the blood is acidic. High PaCO2 means there is too much carbon dioxide. Interpreting ABGs can seem tricky, but it doesn't have to be. Here's a step-by-step guide. 1. Look at the pH. Is it acidic, low, normal, or basic, high? 2. Check the PaCO2. Is it high or low? High PaCO2 means respiratory acidosis. Low PaCO2 means respiratory alkalosis. 3. Assess the HCO3. Is it high or low? High HCO3 means metabolic alkalosis. Low HCO3 means metabolic acidosis. 4. Consider the PaO2. Is it low? Low PaO2 means hypoxemia or low blood oxygen. Let's look at an example. If the pH is low and the PaCO2 is high, it means respiratory acidosis. This could be due to problems like COPD or asthma. Understanding ABGs is crucial in clinical practice. ABGs provide vital information about a patient's respiratory and metabolic status. They help us make quick decisions, especially in critical care settings. By interpreting ABGs correctly, we can provide timely and appropriate treatment. This can make a significant difference in patient outcomes. In conclusion, ABGs are an essential tool for healthcare professionals. By understanding the components and interpretation of ABGs, we can provide the best possible care for our patients.